Hi everybody. I am Amy Frostick with J&A Racing. My husband and I are the race directors of the Yuengling Shamrock Marathon weekend, and I am so happy to be here on Heart Month with Dr. Krishna, who is with Bon Secours Cardiologist. She's a board certified cardiologist, so she knows everything there is that we need to know about cardiology and heart disease and heart health. So we're going to ask her a few questions to discuss, what's best for us and how we can determine different things for our own health and running.
Yes, sounds great.
Okay, good. Well, we'll start with running and heart disease. How can running help prevent heart disease?
So we love running. First of all, we want people to be active, and just being active. Something I tell patients, you have to find something that you like. And actually running can be so goal-oriented. It can be very motivating, particularly when people are training for a race. You can do it by yourself, you can do it with a group, and it's affordable for people. You just have to get a good pair of shoes, really. And so we like it because it's just a very doable type of exercise for most people. Running by itself, we as cardiologists, we really go by just like American Heart Association guidelines and such. And for most of our patients, we just want them to be active. So we just always start with moderate intensity exercise for at least 30 minutes for about 5 days a week. But most people who are actually getting into a running regimen do even so much more than that. And what we kind of say is more is not necessarily better. Like, you don't have to train for a marathon in order to prevent heart disease, but more is not harmful either. And so it's just kind of knowing your body. And obviously people who get into running programs and are really training for races, they've done some recent studies that really show that this could kind of reverse some early signs of heart disease.
Okay. Well, and when you listening to you, it's all fascinating to me how our heart works and keeps us active and running and doing the things we can do. You mentioned moderate intensity with the recommendation. I have this Garmin, which tells me what my heart rate is. It stays on my wrist, so I have no idea how it's figuring this out for me. But
Yes.
How accurate is this, and what do you mean by moderate intensity?
Yeah, well, thank you. That's a great question. And I actually get these questions almost every day. So I've actually done some research on this. So you're correct. And these type of fitness watches are really, really popular. Almost everyone has them these days. It's kind of doing it through this optical sensor, and it's looking at the pulse here. So it is not as accurate when it comes to moderate intensity exercise. So the level of exercise you're doing matters to how accurate this is. If you're really jumping, running, high intensity exercising, technically the chest type heart rate monitors are more accurate, they're more consistent. They have actually done studies, they were small studies, but looking at the different types of wrist monitors, and they're okay, but they can be variable. But I think it's a great start. I mean, for most people who are running, they're going to go with this more than I can imagine when you sweat and running, that the chest strap is a little bit uncomfortable. So this is adequate for most people. And really what we use, when we say moderate intensity exercise, that's a good question because it's actually different per person. So if people are using their heart rate to help gauge their exercise and how much they should be doing or not doing, there's several things that the heart rate monitor can help you with. First, you can calculate what is your max heart rate. Now, a lot of people already know how to do that. You can Google this, but it's basically 220 minus your age. You don't ever want to be hitting your max heart rate right away. And actually, if you're new to running, right when you start getting out there, your heart rate will go up faster, and that just kind of shows that we're a little more deconditioned and we need more practice. So moderate intensity is more when you look at the different zones. You've heard of the aerobic cardiovascular zone, more of the anaerobic zones. So basically, if your heart rates are in the 50 to 80% of max, that's considered low to moderate intensity exercise. So really it's about gradually, no one would just recommend going into a full marathon right away, right? So we start out small, maybe you just try for a mile, then eventually a couple miles, then a 5K, and then a marathon. So for people who are actually doing a full marathon, they already have so much dedicated time that by then they're probably, even their resting heart rate's going to be lower, and the majority of their running time will already be spent in a moderate intensity intensity exercise. People who really are working on speed hit a higher, they hit more of their max, but they're not going to be doing that for a marathon, for an endurance run. That makes sense.
Well, and I've always heard too, a good gauge for running, and I run with some friends, and for moderate, is it being able to talk? Because we'll run 6 miles and we'll talk the whole time, and I've heard that before is gauge or moderate by
that's
if
a
you
great
can have
way.
full sentences and talk while you're running, you're maybe at moderate.
Yeah, and actually I know I have friends who are avid runners, and some of them don't even do heart rate monitoring. I don't think you necessarily have to do it, especially in young and healthy people. Some people just really like to have, we're just more type A and like to just have concrete numbers to help go along with it, but that's a great subjective way to kind of see, am I overdoing it, where am I at right now?
Right, okay, and then with running, like any activity, when do you suggest somebody comes to see a cardiologist? Is it,
No, very good question. So for most people under the age of 40, if you are healthy and active, you don't have any chronic medical problems, you want to at least make sure that you have gone to a primary care doctor, just like your yearly well check. And that's because we do see a lot of young people who say, I have no medical problems, but that's because they don't go to the doctor. So they don't know that they have medical problems. And maybe you didn't when you were 20, but as you know, something changes as we hit 30s and 40s, that our bodies are not the same anymore. So it's just, as long as you've gone to a primary care doctor, they usually do like screening blood work and an EKG. And for most people, that plus an exam is enough to be screening to be able to move forward. But other people that you want to take a little bit of pause is if you have a strong family history of either coronary disease. So this means people who have in your family, young, usually under the age of 55, who are having strokes and heart attacks. Definitely if you've had a history in your family of someone having sudden cardiac death. So that means someone under the age of 40 who's actually died suddenly and we don't know why. Those are all kind of red flag reasons that even if you take great care of yourself, you could have a wonderful diet, you could be exercising for a long time. Just even age alone can impact us, and definitely our genetics. So that's how we see that still heart disease could affect somebody who's like an avid marathon runner who's been doing it for years. That would be somebody that you'd want to kind of follow closer and make sure that they get checked.
that's great, because you can run even if you have something,
Yeah.
as long as it's controlled.
Absolutely, there are a lot of people who have chronic medical problems who can still run. There are very few indications that a doctor would tell you you cannot exercise. And for some people, maybe they just need a more structured, monitored program first before they can really truly just go run a marathon. But for most people, they can we think endurance exercise is healthy.
That's good. Well, and we know that one of the ways to decrease heart disease is exercise, and then I would assume nutrition is probably one of your other things that.
Yes, absolutely. So cardiac disease, coronary disease is very complex, and basically diabetes, hypertension, cholesterol, tobacco, these are all of the modifiable risk factors. But you can imagine all of those things are a result of stress, not eating well, and weight gain. That's what causes and results in those things. So absolutely, we find that people who exercise, people who are eating a well-balanced diet, that they are less likely to get those problems to even begin with. And yeah, diet is a huge part of this, and usually people who are undergoing endurance running have to pay closer attention to their diet because they gotta make sure they're getting enough protein, enough carbohydrates, that they stay well hydrated. And so, yeah, it's a huge part of all this.
Yeah, that's great. So keep on running, eat
Yes.
healthy, and hopefully we'll see everybody at the finish line.
Yep, and you won't need to see me.
Right, exactly, yes.
You won't see me.
Right.
Yes.
Well, thank you for your time, and thank you for taking this time to chat with our runners.
It was my pleasure. Thank you.